Hi, welcome to Ngari Healthcare Tips. This is my YouTube channel. If you have not subscribed, kindly do so. Remember to hit that like and notification bell for any time we upload a new video. You'll be among the first person to be notified. In this video, we're going to talk about cleaning, disinfection, and sterilization of instruments used in the theater or in the operating room. Point to note is instrument used for diagnostic purposes, e.g. the endoscopes. We you are usually advised you only clean and disinfect them. Let us jump into cleaning and disinfection. The important role of these two processes is first, to prevent cross-contamination. Secondly, they prevent personnel from blood-borne pathogens and other microorganisms which may be left on the instrument. Personnel in this area, they usually wear clogs or shoe covers, apron, uniform which are short sleeved, glasses, gloves, and surgical hats, the surgical caps like this one. Then we go for pre-treatments. This is usually done before or in the cleaning phase. During pre-treatment, instruments are spread well so that it makes them, you open the ratchets, you ensure that the joints are well spread so that cleaning can be easy. We usually clean, if you want to clean manually, you use warm water. Then you have some brushes which you use to clean the hard to reach areas like lumen. Also, you can clean in a washer, an ultrasonic washer. Point to note, during cleaning, you use water which demineralized and soap or a disinfectant which has protein digestive enzyme. This makes cleaning very, very easy. Let us now talk about ultrasonic washers. It usually produces an ultrasonic energy which in return creates bubbles. These bubbles, they pound on each other, in return creating a negative pressure which helps in removing dirt from the surfaces. Once this is done, when the dirt is removed from the surface, this process is called cavitation, and this is a question mostly asked maybe in interviews or in examination. You should ask what is the cavitation process. Don't forget that we said when you're washing manually, you submerge your instruments in warm water and use brush so that cleaning in the lumen is very, very easy. Then these instruments, they are taken to the clean area where they are dried, they are inspected, and they are sorted. After sorting them, you pack them ready for sterilization. In our next video, we are going to discuss chemical and steam sterilization. Another thing, during packing, we have packing materials, e.g. if you're using maybe something like ETO or plasma, those packing materials, they are usually made of Tyvek. I think that is basically, but we will go into details in our next video. So stay tuned and follow for that video where we will discuss packaging into details, chemical and steam sterilization into details. Adios.